So everyone is concerned, and tonight we also break the myths around the coronavirus. We tell you the facts about it and why you shouldn't panic. Instead, you should concentrate on preventive care and treatment or relief of the symptoms. Now, this may be things you have heard before or not. The main concern right now is those arriving in the country through the airport or the border points. So how effective are the thermal scanners in detecting people infected with the coronavirus? Now, thermal scanners are only effective in detecting people who have developed a fever, which is described as having a high or more than normal body temperature because of infection, not necessarily because of coronavirus. However, thermal scanners cannot detect people who are infected with the virus. And this is because it takes between 2 and 10 days before infected people become sick and, of course, develop the fever to be detected. Then second, are antibiotics effective in preventing and treating the coronavirus? Well, antibiotics do not work against the virus, only bacteria. And as the name implies or suggests, it is a virus. Thus, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized, you may receive antibiotics because bacterial co-infections is possible. And there are also any specific medication or medicines to prevent or treat the new coronavirus. It's good to know, to date, there is no specific medicine recommended to prevent or even treat the new coronavirus. However, those infected with the virus should receive appropriate care and relieve and treat the symptoms. And those with severe illness should receive optimized supportive care. Now, this is one of the biggest myths we have had so far about this. The question is, does the coronavirus affect older people, or are younger people also susceptible? Be informed that the people of all ages can be infected by the coronavirus. However, older people and people with a pre-existing medical condition such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with that virus. And now let's talk about the preventive measures. And since the source of the virus is China, that's where we begin. It's one of the biggest exporting countries of the world. Thousands of goods and items are sent from China and received locally here. It is safe to receive letters or packages from China. Those of you receiving those packages from China are not at any risk of contracting the coronavirus. From analysis, coronavirus does not survive long on objects such as letters or even packages. The other question is, do vaccines against pneumonia protect you against the new virus? Well, vaccines against pneumonia do not provide protection against the virus. This is because the virus is so new and so different that it needs its own vaccine. Researchers are trying to develop a vaccine, and the World Health Organization is supporting that effort. Let's now take a look at the map of the affected areas. And this is the map. Let's pull Africa out of it. As present, the blue parts are the most saturated, and the greater the saturation means how much it's in that country. Now, this is a global infection map, and Africa, it shows where you see that Algeria confirmed with 2 cases of the virus so far, and 1 was confirmed in Egypt. Those are the 2 countries in Africa that have confirmed this virus. Now, this information, the whole of this information we've given you tonight is available from the website of the Center for Disease Control, that's CDC, supported by the World Health Organization. And of course, you've heard about the use of the masks. Now, this is something you need to know. If you have a lot of facial hair, the beards, you are more exposed because it prevents the masks from sitting well on your face. So you know that.